Hello friends, let's today talk about half knee replacement surgery or unicondylar knee replacement surgery. So basically, before we start, we need to understand what are the three compartments of our knee. One is in the inner part of our knee, which is known as the medial compartment. Other one is the outer or the lateral compartment of the knee. Third is between the kneecap and the femur bone, which is known as the patellofemoral or the front compartment of the knee. Now, half knee replacement is for patients suffering from arthritis in only one of the compartment of the knee. Mostly it is the inner compartment of the knee, also known as the medial side. The aim of half knee replacement is to replace only the damaged compartment which has been damaged because of arthritis. The advantages of this is we are able to preserve the healthy bone created by God. We also preserve all the natural ligaments of the knee so that we get a normal knee movement after surgery without pain. Now let's first understand who is an ideal candidate for half knee replacement. As I said, if the arthritis is only in one compartment, that person is a candidate of half knee replacement. Normally, we check the patients for good range of movement, that is full movement of the knee before surgery. We also check the stability of the knee. We check all the ligaments, especially the anterior cruciate ligament. And also the patient should not have any knee deformity. The patient should have pain only on one side of the knee, that is the affected side. Also, we keep surgery as the last option. Before surgery, we ask the patient to try medicines, physiotherapy, injections, and all sorts of non-surgical intervention. And if nothing works, then only we ask the patient to go for half knee replacement surgery. This surgery is suitable for active patients only and patients who are in the middle age only. Like if somebody is between the age of 40 and 55 and has developed knee pain that is not responding to medicines or physiotherapy, and on X-ray or MRI, patient has established single compartment problem, then only we advise this surgery to the patient. Now here patient selection is very important. Not only clinical judgment is important, but also radiological correlation is important. First, we do a clinical examination to see deformity, range of movement, ligament intactness. If everything is okay, we do weight-bearing X-rays. X-ray, if it confirms that only one compartment is affected, then we can counsel that patient for half knee replacement. But before we say that, we also do a MRI to see if only one compartment is actually affected. Now, not every patient is a candidate of half knee replacement surgery. Correct selection of the patient is very important. If the patient agrees for half knee replacement, if we feel the patient is a candidate for half knee replacement, then we definitely suggest half knee replacement surgery because this surgery can be done through a very small incision. There is hardly any blood loss. The recovery is very fast. The patient can walk same day of the surgery and he remains in the hospital for 2 days only. This gives a better knee bending as compared to total knee replacement. Yes, patients with half knee replacement, they have a better range of movement as compared to total knee replacement patients. Patient feels more like a natural knee, so that the patient gets that comfort that he is still able to walk around with his normal knee created by God. And most of the patients are able to go back home the next day after surgery. Now let's talk about the medical literature support for half knee replacement surgery. There are various long-term studies published in various journals in India, in America, in Europe, which show that if it is done in the correctly selected patients, 10 to 15 years survival rate for half knee replacement is almost 90 to 95%. Overall, if we compare total knee replacement and half knee replacement, here also half knee replacement gives better results than total knee replacement. Also, complication rates are much less, infection rates are much less as compared to total knee replacement surgery. And overall, patient satisfaction score is also higher as compared to total knee replacement surgery. So, if you are young but you are suffering from knee pain and you don't want to go for total knee replacement surgery, then of course half knee replacement surgery is a good option for you. But most important is you come and meet your doctor first, because your doctor will examine you clinically, will get your X-ray and MRI done, and then he will decide whether you are the right candidate for half knee replacement surgery or not. All the best.